Hi, and welcome to this presentation on group therapy. Today, we'll be taking a closer look at what group therapy is, why we offer group therapy as a treatment, who groups are for, what the format of a group is, what is required in order to attend a group, the different types of groups we offer, and frequently asked questions. Groups are a great alternative to one-to-one therapy sessions. Groups are a way of one or more therapists delivering therapy with several people at once rather than on a one-to-one basis. Groups involve meeting regularly in a group setting, and each group is facilitated by one or two of our practitioners, and the groups vary in duration, size, and length. Each group will differ depending on the focus of work and the type of therapy used. Most of our groups, however, are based on a type of talking therapy called cognitive behavioral therapy and are designed at teaching people tools and techniques to manage their symptoms more effectively. Groups are a great option as you can meet others and find support with those who are experiencing similar feelings and problems. For some people, working through their problems alongside people who understand what they're going through can feel reassuring and can make people feel less isolated and alone. Being part of a group offers the opportunity to meet with other people who have similar lived experience, and the group provides a space for shared experiences and feelings, which can help people feel more validated. Group members are also able to help each other and work as a team to move forward with their problems. The group provides the opportunity to learn from helping each other, including raising self-esteem. And groups have consistently been found to be as or more effective than individual therapy for a number of common presenting difficulties. Per our service referral criteria, our groups are open to anyone over the age of 18. There is usually quite a range of ages in our groups though. However, each group will focus on a particular difficulty and as such will have different suitability for people depending on their difficulties and needs. The format of the groups are as follows. To begin with, there is an introductory session which outlines the purpose of the group, including establishing a group agreement to make sure that the group is a safe and supportive space for everyone attending. And there is also an icebreaker which allows people to meet the other group members. The remainder of the group then takes place over the course of a further 5 to 7 weekly sessions. And the duration of each group session is between 60 to 90 minutes and takes place the same time each week. And we usually have 1 or 2 therapists running each group and between 8 and 12 participants in total. In order to attend the group, we require a commitment to attending sessions. That's because our group sessions are designed to follow on from each other and closely replicate what you would cover in one-to-one sessions. And just like a course of antibiotics, the group is most effective when attended regularly. You wouldn't expect an antibiotic to work if you only took the first and last tablet, and therapy is no different. If you miss more than 2 sessions of a group, we will ask you to attend another one where you are able to make a regular commitment. We also require an openness to new perspectives. You will meet and connect with others in the group, and different perspectives can be gained from other group members. This isn't to say that your experience will be exactly the same as the other group members, but we ask people to come in with an open mind and respect similarities and differences with each other. We do also require you to practice the tools and techniques away from the group sessions. With any new skill, the more you practice, the easier it will become, and therapy is no different. And also, we do require the ability to set limited, achievable goals to work on during treatment, which helps people have a clear focus for the group sessions and is also really helpful at the end of the group sessions to see whether progress has been made or if any further support needs are required at this point. We offer a variety of groups for a range of difficulties. When you have a telephone assessment with a therapist here at the service, usually they will recommend a group that is in line with your current difficulties. There may be a choice of different groups that are suitable for your needs, and in which case you will then be able to make a decision on which group you feel would be most helpful for you. Most people feel anxious about attending a group session, and you won't be alone. However, everyone there wants you to feel comfortable and learn how to improve your well-being. And we often find that people stay in touch with each other after the group ends and provide an invaluable support to one another. And we have lots of great feedback from people who have attended our groups, even the people that weren't sure that groups would be helpful for them. Although no one is required to speak in front of the group if you don't want to, participation is encouraged to help you get the most out of the session, but we keep these discussions based on the topic rather than personal experience. We will never put you on the spot to contribute, and if you do not wish to take part in the group discussions, that is okay, and you will not be forced to contribute. But we do strongly encourage active participation in the groups, as we know that people tend to benefit more from group treatment if they do. And it's quite a common question for people to ask about what happens if you know someone in the group. And really, this is quite rare and rarely happens. But if you are ever uncomfortable in a group because you know someone, for example, you can always ask to attend the next one. However, there may be positives in seeing someone you know at a session. It may be that you both hadn't been open about your difficulties before, but now could be a support to each other. Here is some of our group feedback from people who have attended our groups. If you would like to read some more feedback about our groups, you can visit our website. So to summarize, groups are just as effective as one-to-one therapy, and groups provide the opportunity to share and learn from other people as well as from the therapist. And it is really normal to feel anxious about the idea of coming to a group, but we have lots of great feedback from those who have attended, even those who are really anxious and worried about coming to a group before the group started. And we offer a range of groups to help you find practical ways to cope with your difficulties.